Thanks. Excuse me. I'm Harry Greenspun, and as Bill mentioned, I just joined Deloitte from Dell, and they had to change a couple letters in my business card. It's funny, you got a doctor, a lawyer, and an ethicist on the panel. Sounds like we're getting kind of a bad joke. I spend most of my time talking about health IT and how do you transform healthcare through IT. And I got involved in this ages ago when I was doing minimally invasive heart surgery at Hopkins. And we were following those patients with paper forms. And at the time the internet was getting off the ground, I thought, there's sort of a better way of getting information on these patients and comparing it with other places. And what I found interesting over the course, I was back in 1993 or so, when the future was just around the corner, is that healthcare, as people have mentioned, is way behind other industries in the adoption of IT. But oddly, you could go to a hospital or doctor's office, it's filled with advanced technology. We've got lasers, we've got robots, we have all sorts of cool things. And yet information is one area that we really have been caught up in. And so one of my big areas of interest has been, what is it going to take to get healthcare to adopt information technology and the free exchange of information? And what is it going to get for patients to demand it? We often have people ask me, can you give me an example of a great innovative place in healthcare that's doing something in IT? And I go, why would you look in healthcare? Right? Why not look in any other aspect of your life? I mean, how many of you use OpenTable for making restaurant reservations? Show of hands. How many of you can make an appointment with your doctor online? A couple of Kaiser members, I assume. And the other, we take for granted that we can track a FedEx package across the country, around the world, moment by moment. But you go to your doctor's office and they'll tell you, we're going to take this lab test from you, and we'll call you in a week or two, only if it's abnormal. I bought a Mini Cooper years ago, and I could track that thing through the factory and then across the Atlantic, moment by moment. And more basically, when we think about advanced technologies, who likes burritos? Anyone have the Chipotle app on their phone? Okay, we got a couple nods back there. So, so what the Chipotle app does, for those unfamiliar, is you can identify the nearest Chipotle based upon your GPS coordinates and order a custom-made burrito exactly to your specifications. And when you arrive there at the appointed time, it will direct you there. It will be waiting for you in a bag paid for. Okay? But if you're standing in the street ordering your burrito, get hit by a bus, do you think you could find a surgeon who took your insurance? Right? So we have this great disconnect between the two of these things. I'm wondering, why is it that all of us would be, experiencing, financial services, all these other areas that we are so ingrained in, and we'd switch from a bank that didn't have adequate online banking, and yet we will go to a doctor where you can't make appointments, you can't access your records, you can't do any of the other things you can do in any of the services you receive. It's almost like an episode of the Flintstones when you step into your average doctor's office or hospital. And so what is it that we can do, what are the drivers that are going to make that demand, whether it's from the government, whether it's from industry, or whether it's from the consumer side to make that happen. So with that.